The reason we would want to talk about adolescents uh, as an important uh, maybe participants in part of the health system is because they make up almost 20% of the total population anywhere. And if you see the graph of India, their population has been significantly uh, increasing in sense of numbers and proportion both. So the outline of this seminar is briefly we are going to define adolescence and different stages and understand what is it that makes it different and important to address their needs. What are the physical, psychosocial, and physiological changes that are happening during adolescence that we should be aware of? What are the relevant or associated health problems that might occur during adolescence? And then finally, what do we have there to offer them as part of life skills and Government of India initiatives? Okay. So if I was to discuss not just about them being a number, but also realizing that what are the problems or why is it that we want to focus our attention on adolescent health problems. So anybody who can like feel free to respond on the chat, but what do you think would be the major problems that are different from a pediatric age group or an adult age group, which makes this age group special? And they need to focus on their specific problems. What could be the problems that we are frequently going to encounter with them? Please use the question box. Mental health is correct. Yes, very good, Dr. Swati. Pubertal issues, yes. Peer pressure, new hormones, yes. Yes, you're correct, Nana and Nandini, very good. What do you read in news? What is there on social media? When you hear or talk about blogs on adolescents, why are they in news? For good or for bad reasons? Usually for drugs, yes. So they are in news for, I will not say because of their problems. It is not their problem. It is our problem that they get into these problems. Yes, drug abuse, accidents, drowning, road traffic accidents, overspeeding, right? Getting into sexual assaults, yes. Sexual and reproductive health, teenage pregnancy. They are in news most often. They are in news for things which, yes, unwanted pregnancy or teenage pregnancy. Shreya, you are right. So they get into news because of their age specific problems. But if you were to ask them or understand what is happening, it is not just because of their problems. It's also because probably the community is not yet sensitized to address their needs and help them out, right? And what you earlier said, mental health problems, pubertal issues, normal growth, yes, societal tendency. So mental health burden, again, during the entire, now you're about to complete your MBBS curriculum, right? During this entire curriculum, when did anybody of us teach you or let you focus that have we gone out to the community to address these needs? Remember, this is not a medical emergency. They will not walk into the emergency with these issues. This is where we have to reach out to them, understand what is going on, why did this happen, and then help them so that these problems can be prevented. So global data is equally dismal as much as you've entered as their problems. Enough number of people, adolescents are dying every day with accidents, or maybe to put it in better words, as preventable or treatable causes: road traffic accidents, suicides, drowning. Again, a little burden of infective diseases and other diseases which we have cure for. Mental, again, mental health disorders, most of them or half of them would begin before the age of 14 and would persist till adulthood. So again, we never, there is no system well equipped, even in schools, even in colleges, where we can reach out to them, right? There is a counselor, but I'm sure, like, as compared to what the schooling which I had, compared to the schooling which you've all underwent, and the schooling which maybe your younger brothers and sisters are going, none of them, none of the counselors are able to address this such that there are like preventive clinics or there is a preventive counseling going on. No, they are just there for most places. They are just there to sit as a counselor. Again, remember, private schools are just 20% of of the total services available. Government health school burden, government schools, like let's not even talk about what services do they offer. And yes, as some of you had already mentioned, teenage pregnancy, unwanted pregnancy, taking a toll not just on the baby, also on the young teenage girl. So if we were to define adolescence, this period has been defined by WHO from 10 to 19 years. And remember, what they defined is not just an age range. There is something specific about this age range because of which this period is significantly different. So it is a period of life with specific health and developmental needs and rights. As you had just tell, they have different pubertal needs. They'll have different mental, not mental maybe, but yes, psychosocial needs. It is also a time to develop knowledge and skills, learn to manage emotions and relationships, and acquire attributes and abilities that will be an important aspect for enjoying the adolescent years and assuming adult roles. So remember, the second part of this definition talks about how this acts as a bridge of that young individual into maturing into someone adult. Go back and remember how your adolescence was. It was a period where there were conflicts, not just interpersonal, but even within your own mind. You had conflicts. You wanted some direction, some clarity. With age, maybe towards the end of your adolescence, there was some clarity, and they were obviously all that was happening was a part of maturation, which was helping you assume a more adult, a more responsible adult role. So changes, if we were to broadly talk about, they could be physiological, physical, and psychosocial. So physiological changes, a lot of this is if you remember your physiology, a lot of it was mentioned for in every organ the way the physiology worked. But to emphasize here, we'll be talking about the cortex per se, because that is something which significantly matures during this period. So we are talking of maturing and not just increase in size. So cortical gray volume peaks in pre-adolescence and then decreases because of selective pruning. So remember, this is the time where they're acquiring skills and they're going to mature. They are going to probably evolve those certain skills better, which they will be continuing throughout life. So among you, people who started to learn music, or started to develop interest in engineering or robotics, like that is something that keeps hanging on, and that is what you grow on with time. So the cortical gray matter also accordingly adjusts for these maturational changes that are happening. The cerebral white matter volume also increases, reflecting increase in myelination. And what is also important is the prefrontal cortex, which is responsible for executive functions like decision making, organization, impulse control, and planning for the future. Okay, so this is something which makes this period. It is a part where the brain is learning to understand, control emotions, attain autonomy. And among the physiological changes, also important is the part of the brain which controls your emotions and response, the limbic system, which controls your reward processing and sleep regulation. So this functional MRI images just show that how that limbic system area, which is there in the purple thing, has matured from neonatal till the adolescence and late adulthood age, and how this neocortical area, if you look in the frontal cortex, how this prefrontal cortex is also matured with age, which is the one which is responsible for your decision making and other higher executive functions. So apart from that, the other physiological changes, there would be some increase in hematocrit, increase in blood pressure, increase in lungs vital capacity, and a very important part comes of the sex steroid hormones, which we will be talking about when we talk about puberty. Uh, some other age-related factors, physiological myopia, some skin changes in the form of acne, a little bit of hair fall. So all that is part of normal physiology and normal growth, need not be worrisome. Okay. So after the physiological changes which were happening inside the body, what is also evident during adolescence are the physical changes. So if you can relate to this graph, this is the combined WHO and IAP growth chart, where the lower part shows weight and the upper part shows height. And for adolescents, if I was to show you, concentrate somewhere from in the middle of the chart, where the age marked is around 10 years, and see how the curve grows. So if you can realize that the curve, especially for height, if I was to ask you to focus on height, these curved lines were a little steep in the early childhood, then they plateaued a little, say between 5 to 10 years of age. And if you look at around peri-adolescence or 10 years of age till 14, 15 years, there is again a little peak in the height which is occurring across all centiles. So definitely it is during adolescence that children start growing. They would grow in height and weight both. Even for the weight trajectory, if you would see, the weight will increase. So amongst the adolescent health problems, if I was to ask you to narrate all, nutrition, both under and over nutrition, become important during this period, because this is a period where there is rapid change in body size as such happening, right? And remember, growth during adolescence cannot be interpreted without interpreting puberty. Pubertal onset and pubertal timing has a very important um, part to play in physical changes and physical growth also. So this is just to show, like what some of you had already mentioned, that there were puberty related issues and sex hormone related issues which can happen during puberty. So in childhood, there is generally an FSH, um, uh, generally FSH is more than LH, which maintains those levels in the pre-pubertal period. However, there is an LH peak, a pulsatile LH peaks starts occurring when the onset of puberty, which heralds the onset of puberty, and it is this which triggers the pubertal period. So, if I was to ask you what determines this LH pulse generator, what determines that this would start or begin puberty in different people at different rates? Anybody? What would determine when puberty happens in different children or adolescents? I can't see any responses in the question box. Have I lost connection? Okay. Okay, now, yeah, now I can get your results. So pulsatile GNR is released. Yes, Nikta, I'm asking what triggers, what affects, or how will the body know that they have to release this GNRH now? Leptin levels, yes, Prateek, you are right. Nutrition status of the child, yes, yes. So maybe nutrition and leptin, what you're saying is something together, something like related. Fat status, yes. Maturation of hypothalamic pituitary axis, yes. Perineum, sorry. Adequate energy reserves, yes. So at least most of you would agree here that nutrition per se will definitely affect whether the child goes into puberty or not. Again, both over and under. Anorexic athletes do not have puberty early. They would have some part of delayed puberty. And likewise, if you have been reading a little about news and health care, etc., children who are fat or obese tend to have earlier pubertal development, right? Anything else? Anything else that would affect the pivotal onset? Usually, like final years do answer the genetic component. So remember, familial or genetic reserves, yes. Genetics, so now it comes Pragya, thank you. Chronic diseases, yes. So children who have chronic underlying diseases usually will have delayed pivotal onset. So the pituitary axis is not like that of a normal child. Genetic factors, not just genetic aberrations or mutations, I'm also talking about how and when their parents matured or had the pivotal onset. So that will also affect the timing of puberty in both boys and girls, right? So age of menarche in mother is important to be noted for girls, and the age when pubertal onset, maybe not just pubertal onset, but age when like for a boy, the father started having mustache or started shaving, that age would roughly correspond to when the son would also have pubertal changes, right? So most of you have mentioned most of these factors. So age, what determines the age of puberty? Obviously, the age of the child also. Like we would not expect a 9-year-old to start having pubertal features very early. Generally, the ages after that. Genetic factors, most of you have mentioned leptin, role of other neurotransmitters and other genetic factors like DAX and FGFR also are known. Nutrition, again, as I mentioned, both over and under affects timing of puberty, and there is a role of central neurotransmitters which become important during periods of stress, illness, etc. So just a word about the neurohormonal control. Leptin is a key player in affecting the GnRH pulse regulator and also the role of KIS1 peptide. So this is one peptide which they have discovered, which also interacts with all these neurokinins and neurotransmitters in affecting these GnRH pulses which are released from the hypothalamus. There is also a role of endocrine disruptors. So if you've been reading a lot about environment research and health related outcomes, role of bisphenols, how they affect the entire endocrine programming or the genetic programming in utero for pregnant mothers, for pregnant women. So there is a role of endocrine disruptors with new chemicals, fertilizers, etc., which can also affect these pivotal timings. Right. So if I was to talk about the pattern of growth, once we know that puberty is important during adolescence and there are factors that would affect it, what happens in puberty is what we should understand. It will be different in boys and girls. In girls, the first sign of puberty is thelarche or breast budding, and there is always a sequence to how children would mature. So the process, breast budding would be followed by pubarche at an average period of maybe say 6 months. Then there would be a growth spurt. Finally, menarche and part of adrenarche, after which usually the linear growth would cease in size. In boys, if I was to show you the pattern of growth, again, for them, the first sign of puberty is increase in the size of the testes. So increase in testicular volume by more than equal to 4 ml, followed by some change in voice, some lengthening of the penile length, and finally pubarche and adrenarche going side by side. So what is also important for to be registered for this pattern of growth, in girls, the growth spurt occurs earlier during puberty, and in boys, growth spurt is generally seen towards the later half of puberty. Okay. So the way we would want to score or understand these pivotal changes objectively is by using the Tanner's sexual maturity rating, which gives 5 stages for both boys and girls and scores them as to which stage of puberty they have already attained. So in girls, stage 1 is prepubertal, where there is no breast bud and there is no pubic hair. Stage 2 is when there is a breast bud, if that can be palpated or can be seen on a lateral view, and there is some early pubic hair, and gradually this would increase in shape, size and amount to attain the adult pattern of pubic hair and adult breast contour and size to make it stage 5, right? And in boys, there would be increase in the testicular volume as has been shown here as 4 ml. Once the testicular volume becomes 4 ml, both sides, it is taken as pivotal onset and gradually would increase in size with increase in pubic hair and can be scored depending on how much of testicular volume it has been achieved. So 4, 10, 16 and 25. And the most relevant question which should be coming next is, how do we know that it is 4 ml or how do we measure the testicular volume? So there is a separate device called an Orchidometer with which we can measure the testicular volume. It has beads of different volumes, and these can be compared to the patient's or the child's testicular size and can be quantified objectively. Right? So this is this graph is important because it shows the interplay of both puberty and linear growth. So when I'm talking of growth during adolescence, remember, it is both. It is not just growth means weight and height, it is also puberty, because unless you talk about pubertal growth during adolescence, you're not actually talking about growth. So what this shows is that it is usually the breast size that would increase in girls, the figure on the left, and at an average period of say another 6 months or so, pubarche would start. The height spurt would occur somewhere between SMR stage 2 and 3, and menarche would occur later. And remember, once menarche occurs, the height velocity or the rate at which height is increasing, this would plateau down, and they would girls would slow down and finally attain their adult height. Unlike in boys, if you see, there is an increase in testicular volume followed by puberty. This would keep happening till such time that a height spurt occurs towards the later half of puberty. And if you see, there is no single cutoff of age. But yes, this is an like these figures are a little old from textbooks, and they would show you that roughly the age of pubertal onset in both boys and girls would begin around 10 years or 10 between 10 and 11 years. So this is just to summarize what we've understood in the last 3-4 slides. This is height velocity. Height velocity is how many centimeters per year the child grows, right? Just concentrate on the graph first. So if you see in childhood, the child initially in infancy would be growing somewhere around 8 to 10 centimeters per year, and that would gradually slow down to say 6 to 7 centimeters per year, would decrease a little just before they have their pubertal onset, which is governed by the LHP, pulsatile LHP. And once the pubertal onset occurs, depending on which stage of SMR they are, there would be a rapid increase in the height velocity or increase in the height, meaning every year they are growing at a rate of say 6 to 8 centimeters per year again, reaching to total of around 20 to 25 centimeters during their pubertal period. So for if you could like ask me, they would not keep growing till 10 to 19 years of age, but each child would have their specific period of pubertal growth in which they would be attaining anywhere between 18 to 25 centimeters of total extra height from what they were. Also, what this graph shows that girls would be maturing earlier than boys. So if you were to go back to your school age or maybe compare yourselves with your brothers and sisters, girls would always become taller earlier than boys. However, boys would still outgrow the girls, though they would grow a little late, right? So 9, 10, if you would remember your sections, your girls would be the boys' height or would be as tall as boys. But 11, 12, if you would remember, boys would any day be taller than girls in the school. Okay. So I'm reiterating, pubertal growth has to be interpreted in light of linear growth. Both of them should go hand in hand and not separate. If there is deviation or they are not in concordance, then there is some pubertal or hormonal problem also. Okay. What also needs to be checked during this period is skeletal growth. Skeletal growth is assessed by bone age. So if I was to ask you, how do you order or which X-ray do you order for bone age? I'm waiting for an answer. Which X-ray do you order for bone age assessment in adolescents? X-ray wrist in particular. Yes, Pratik, very good, correct. So not wrist, I would say not just wrist. What we are looking is at wrist, hands and fingers, right? Wrist will only give me carpal bones. If I was to, no, not whole upper limb. We don't need the whole upper limb. So we need the wrist, hand and fingers. And what we want to see there is the rate at which these epiphyses and metaphyses are maturing and maturing in appearance and have fusing with the metaphysis and the epiphysis are fusing. So distal radius gets included, carpal bones get included, the metacarpals and the phalanges and their epiphysis. Everything has to be assessed. Okay. So having talked about what is normal puberty and why does it occur and what are the patterns, we have to also understand that when would we become concerned about the pubertal progression that is happening. So the constitution, delay and growth and puberty, I will not speak much about this because this is already covered in initial part of your lectures. But remember, we also take this as a normal variant in growth and puberty, where growth has to happen and will happen as normal adult height, but there is some delay in the onset of growth and puberty in these children. So what is one important thing in history that you would be wanting when you are evaluating a case of suspected constitution delay in growth and puberty? What should I be asking for a child whom I'm suspecting as constitutional delay in growth and puberty. So if I see a 13-year-old boy who has not yet started any pubertal features, the parents are very concerned for not growing. Yes, so not maybe just parents, but yes, the father's age of onset of puberty is very, very important. If you take that history and if you can follow up the child with his previous height records, then 99% of them don't need any other fancy hormonal investigations. The diagnosis can be made, is clinical. Okay, thank you. Good. So again, delayed puberty. So as I talked about, there is always an age range when puberty would occur, but that window would vary anywhere between 8 to 13 years in girls and 9 to 14 years in boys. So anything happening before 8 years in girls or 9 years in boys is worrisome, known as precocious puberty. And anything happening after 13 or after 14 years in girls and boys respectively is delayed puberty. I'm not going to talk about what are the causes and how to investigate, because pubertal disorders, this is all theoretical, and I would request all of you to please refer to the endocrinal chapter in the book, where they have given it beautifully. I need not repeat everything, but when you are reading those tables, just remember, as we had shown you in the hypothalamic pituitary axis, for puberty to occur, hypothalamus, pituitary, and the gonad, all three have to be aligned and in sync. Any problem occurring at the higher level or at the gonadal level will cause a disturbance in puberty. So when you remember the causes or you're asked to write a short note, at least if you were to recollect, start from what can go wrong in the hypothalamus and the pituitary, what can go wrong at the gonadal level, and then you can maybe, it is easier for you to remember. Also in precocious puberty, remember, there can be exogenous hormones which are being produced or which can affect puberty or which can mimic puberty. So in precocious puberty, you get those causes also as causes of precocious puberty. Okay. Okay. Any questions still here? Okay. We go to the next part, which are the psychosocial changes. Again, I reiterate this. These are one of the most important changes of process of development which need to be recognized during this period. There is a unique sensitivity to effects of dopamine and reward relevant subcortical structures during this area. Remember, they are maturing, and that is why someone, like, if you were to see how juvenile delinquency happens or how they become involved with crime and substance abuse, anything which gives them reward is something which triggers happiness, and it is very easy for an adolescent to connect with that thing without realizing what could be the implications of the same. There is reduced responsiveness to aversive stimuli, right? And they have their own sense of morality, decision making, autonomy, etc., which is developing. Search for a new identity or creating an identity. Alternative adult role models. So obviously there is a shift of role models from what they were in school to now what they would want. So a pop star, a cricketer, like they would have their different or maybe evolving role models. Peer role models also emerge, and definitely their own curiosity or anxiety related to their own sexuality and what is happening around self role in society. So all these are issues which are complex and which are evolving during this period, right? So for the sake of understanding how the brain matures, stage adolescence has been divided into early, middle, and late stages. I think this table is there in the handbook of tutorials which you have. I will not read out all these, but just remember, early adolescence is when when the person has just crossed that line of 10 years. So he's like a young child maturing. So they are just, it is more of a state of confusion. They would still be obeying or following commands, but they are obviously wanting to search, need for privacy. They are more conscious about what is happening to them. Unlike middle adolescence, where there is a total stage of storming, confusion, strong emotions, right? They get more and more, they start more and more introspecting, more of identity search, more conflicts. And late adolescence is generally the time where they are in the settling phase. So what have they agreed to? What are their future roles? What is their assessment of risk or benefit with something that they're going to do? Morality decisions. So they are more of they are more into consolidating phase in the late adolescence. Okay, so after having understood what could be the physical, psychosocial, and the uh, physiological changes, what all could be a list of medical health problems. Now, if I was to ask you that question again, anything new that you would want to add in your list from what you told me earlier regarding problem statement? What more problems do you anticipate they can have? Yes, anemia becomes important. So micronutrient deficiency is not just anemia, also calcium deficiency. And remember, bone mass, adolescence is the period where they are going to acquire their peak bone mass. Bones don't keep growing for forever. Only anemia, nothing more. People don't have anything more to contribute. So if you were to get a short note on medical health problems during adolescence, if you write very little, then remember you won't get marks. So from whatever you could understand, you have understood as risk, psychosocial issues, medical health issues, eating fads. Like this list is also not exhaustive and not complete, but I've just listed them down so that you collate from whatever we've understood till now as physiological development or developmental process which is happening. Okay. Okay. So the fourth point reads predisposition to infections and role of immunization. So what all vaccines can be given to are specifically intended for adolescent immunization? Yes, you are right, Shiva. HPV, tetanus, maybe not just adolescent immunization. Tetanus is also neonatal immunization. What more vaccines become important for adolescents? Hepatitis B to high risk. Now, though it is universal hepatitis B, so need not talk about hepatitis B. It is universal hepatitis B that we talk about. Hepatitis B boosters not yet recommended during adolescence. There is a checklist when you apply for USMLE or you have to go outside. They would ask vaccinations for these when you're going for hostelers and schooling. That is all part of uh, okay, not HIB and PCV. No, HIB is infant 2 year. Disease burden is only till 2 year of age. Pneumococcal is also childhood disease, not adolescent disease health burden. Influenza can be any age, but again, if you were to ask me, influenza is not for adolescents, elderly and infancy. Hepatitis A also, no. Hepatitis A maybe for travelers. Okay, so this is homework for all of you. Go back and read what is the list of immunization recommended for adolescents by CDC, Centers of Disease Control USA. Japanese encephalitis not just for adolescents. Japanese encephalitis 9 महीने पे लगता है national program में. Meningococcal yes, Hostler especially. Okay, now we'll stop this guessing game. Enough of guessing you've done. Read, go and read. You'll remember when you read yourself. Okay. Okay, and what I've mentioned in blue here, uh, just to complete the line list, which I have not otherwise mentioned in the physiological changes, important to remember mental health burden of cyberbullying and cyber addiction, especially pre-COVID also it had started. And with the COVID thing and everything going online, cyberbullying and cyber addiction, both are important mental health concerns which need to be addressed. And there are separate workshops which are now conducted in schools for teachers, for parents, where how they can help children deal with problems of cyberbullying and cyber addiction become important. Okay. Okay. So this graph just shows why this again. I'm again and again coming back to the issue of why adolescent health needs to be addressed in a more important way. Because if you see, 50% of those who started tobacco during adolescence would continue to smoke even during adult age. 31% of those who were inactive, physical inactivity, were obese, had alcohol, would remain alcohol dependent and would have more risk of adult onset obesity and other non-communicable diseases. Okay, so if I was to ask you, knowing that this period is important, and knowing that most of the changes or most of the health problems that are occurring are not because of their like a problem person. It is a part of their psychosocial changes which are happening. And if at this time somebody can guide them, somebody can help them discover their identity, somebody can channelize their energy into more productive events rather than them landing up into substance abuse, obviously the overall outcome of not just adolescents but also the adult race that would result would be much better. Okay, so the concept of adolescent friendly health services came up here, and the bar graph that I've shown here is just an extension of what I was talking about, cyberbullying being important. And like, people who say or feel that this may not be important or this may not be a major health problem in, maybe a problem just in the elite class, remember cyberbullying and cyber addiction is also happening in the rural health setups. Okay, and that is why there is a need for not offering hospital services to these adolescents, but what we need is to reach out to the community where they are and where they can be addressed as a group and as some people who are normal and who are common and not outliers who are abnormal. So again, the importance to assess if she had any issue, say headache, she had acne, she had any simple medical health problem, if she was to visit a healthcare center, who will assess? Will it be a pediatrician or will it be a medicine person where there are geriatric patients, like patients more than 70 years with diabetes, some are coughing, some are sitting, some are spitting. Where should she go for her little concern that she has? Who assesses her? Does a dermatologist assess, only give her a topical, say, a ointment and send her back? Who will assess, is she having any other related stress, any dietary issues? Is she overweight? Is she underweight? Even if she is normal weight, does she have anemia? Is she taking her meals normally? Does she have a sound mental health? Is she into addiction? Or is she going into addiction? Or has she developed any risk-taking behavior? And isn't it important to assess everything in this girl also, so that we ensure that she grows into a normal person? So there is a role of preventive health checkup. Again, preventive health checkup for somebody who's normal, she will not walk into for a preventive executive health checkup, unlike somebody who's 70 years old. So how do we address them? This is the biggest challenge that has to be addressed when we are dealing with adolescent health. And WHO gives us this tool of HEADS assessment. So HEADS is just a acronym for what all needs to be assessed in an adolescent. So remember, home situation, education, employment, eating and exercise. How is she eating? How is she exercising? Is she relaxing? What have been her activities and peer relationships? What has been her or his drug use, which would include cigarette, alcohol, and everything other than that also. Sexuality issues, if any suicidal or thoughts of depression, and spirituality. So all this has to be assessed for any adolescent who walks into a maybe not, I would say, hospital, but at least an adolescent friendly health service. This cannot be done in the hospital, in an OPD. So let's see. Priya is a 14-year-old girl who has started missing her school for the last few days. She complains of frequent headaches and abdominal pain, and the mother has brought her to the medicine OPD. So what do you think will be the standard flow, or the standard plan of treatment for this such a case? So maybe when you are interns and you see this, and the SR tells you this is a not complicated case, she just has some abdominal pain and headache. You are qualified MBBS doctor, so you can pretty well see. So most of you will end up writing Digene or Antac, some paracetamol. Some of you who are a little more uh, like who spend a little more than 10 seconds with the patient would ask her for some eyesight issues, would refer her to Guru Nanak for an eye checkup. Maybe that's all that you would be doing. But if we were to address her as an adolescent whose needs are different and special, we would have been a little more inquisitive about why is she having abdominal pain and headache. If it is not organic, remember, I'm not talking about organic causes like appendicitis, peritonitis. I'm talking about something in which she's just a casual, she's walked into your OPD and she appears totally normal, fit medically. So her friend's mother would tell that she has reported that she has not been socializing of late, घर में पड़ी रहती है, बात नहीं करती है. And on further probing using the heads assessment, the girl opens up. She discloses father has lost her job, becomes violent, beats the mother. There are constant fights on petty issues. She also feels scared, and her two little sisters. She does not have any addictions at present. So your focus of treatment and management shifts when you approach an adolescent as an adolescent and not as a patient. So the heads assessment, if we were to do an heads assessment for her, the home situation she is living with a mother and father, younger sisters. Father has lost job recently. There is something happening in the home. Education, she is missing school, has poor school performance. She eating and exercise, we can ask as leading questions. Has she been overeating or has she stopped eating, or is she only consuming junk food and stress? How have been her activities? So they have definitely decreased. She does not have any drug intake till now. Yes, she has some early clues of depression. She has difficulty in falling asleep. So sexuality, we can ask some leading questions. Any suicidal tendencies, again leading question, and safety issues. So if she has felt worried for herself and younger sisters, safety issues, has she ever tried to run away from home? Or what is it that is precipitating these psychosomatic symptoms in the girl? So this is how we would have managed this case if she would have come, or if we could have addressed her in an adolescent friendly clinic. So there were some risk factors this child had, and obviously protective factors, sibling support, parental support becomes important. Her life skill for herself, that yes, she need not be feel vulnerable, she can be more responsible for her education and need not worry. So life skills is something that gives each one of us an opportunity to get over our day-to-day problems and maybe cope up with stress and grow out into a more mature and better, a person who's more capable of handling pressure. So I'm not sure how many of you have done life skill workshops in schools. These days most schools do have these life skill workshops happening. So they would address critical thinking, creative. There are usually 10 skills that are covered: critical thinking, creative thinking, decision making, problem solving, empathy, effective communication, interpersonal relationships, self-awareness, how to cope up with stress and emotions. Right? So people who are still bugged down with COVID, they can do a little life skill workshop online if they want. There are many happening these days. But yes, it is important that these are taught to them right during adolescence. Once they're 40, once they're 45, adult life, there is no point of teaching life skills then, because most of the events or most of the career formations and emotional growth, all that has happened in adolescence and young adulthood. So this is important if we reach out to them early. And now comes the role of Government of India initiatives to emphasize what all can be addressed as adolescent for adolescent well-being. So if you were to get a short note of Rashtriya Kishore Swasthya Karyakram, RKSK, what I will request all of you, beyond from what you've learned in your PSM as pillars and ministries who are coordinating with with RKSK, thematic areas, remember, for me it becomes important if you can tell me what is there in the program for my client and not what is there in the program as part of ministry. So 6 key areas: sexual reproductive health, nutrition, non-communicable diseases, substance abuse and misuse, injuries and violence, and mental health. So all these are 6 pillars. But how are we going to get these services across to the adolescents is what I'm more interested in, right? And which should also be included in your answers or your write-ups. So a community-based approach, school-based approach. Remember, facility-based approach is usually for referred cases who need advanced counseling or advanced services. Most of things which are happening in RKSK are at the community-based level, where there is a role of peer educator, adolescent-friendly health days, weekly iron folate supplementation, which is you had mentioned anemia being important medical health problem, right? And obviously linkages with other platforms also. Screening of these adolescents in schools, both government and public schools, and emphasizing on prevention of micronutrient deficiencies is all part of RKSK, right? So to conclude, adolescence is a period of rapid growth and development. Remember, all adolescents have their own physical and psychosocial issues. HITS assessment gives you an important tool for assessing an adolescent for his or her needs and issues. I mean, it is easier said than done, but do not preach or teach adolescents. Remember, we can only offer them counseling. We can only help them identify what is wrong, or maybe not even wrong, but what might be worrisome later for them. But do not preach. Do not tell them that cigarettes are bad for health. They know that cigarette is not good for health. But if they are still not being able, if they are still addicted or they are still not able to give up, we need to identify the cause and not tell them the solution of giving up cigarettes. Right? There has to be something more. Is it peer pressure? Are there any mental health issues which they have? Okay. So RKSK is one Government of India initiative where the government has made an effort to reach out to adolescents for their preventive and wholesome health. Life skill education, community ownership, and positive parenting are important to ensure that adolescents have a healthy future. So thank you. And this is just to conclude that an adolescent brain actually has much more than what you and I could think of. There is too much of, I will not say garbage, but there's too much of clutter. And they themselves may be more confused than what we think them to be confused as. So maybe what they need is a little help, support, support in the sense of a positive support, so that they don't land up into troubles and issues. And WHO also acknowledges that investment in adolescents brings triple benefit of not just healthy adolescents, but healthy adults and healthy generations. So thank you. Any questions? There are no questions. Remember two homeworks: adolescent immunization and delayed and precocious puberty is, as for short note, is something that you will read up from your books. I have not included those slides. There's no point I read up things which are there in your book. Okay. So if there are no more questions, I think we can close. Maybe enjoy the weather for some time more till we start the next tutorial. Thank you.